Hi, my name is Adrienne Dragoo. I'm a first-year massage therapy student, and this is my project for pathology class. I chose Myofascial Pain Syndrome, which is a debilitating disease of the muscles and associated soft tissues with pain that radiates from one or more tender trigger points throughout the body. And here's my trigger points down here. There's 4 types: active, latent, secondary, and satellite. The trigger point forms down here by many nearby segments of muscle that are stuck in the contracted state. And the most common areas for that to happen is going to be up here. This is your back view. So it's going to be your sternocleidomastoid muscle, which is in your neck, your trapezius, which is right here, the levator scapula, infraspinous, which is down the spine, rhomboids, which are over here. And those are mostly where your trigger points appear. There's some down by your tailbone and your sciatic nerve down there. And active trigger points are the ones that lie within the muscle and they cause the local pain. Secondary trigger points are located around the active ones, and they can be irritated at the same time. Latent trigger points are dormant, but they have the potential to be active if irritated. And the satellite trigger points, they're inactive, but because they overlap the other ones, they're still a little bit there. Okay, the causes of myofascial pain syndrome is pressure on sensitive points in the muscles that cause pain in seemingly unrelated body parts, and that's called referred pain. That's how people diagnose myofascial pain syndrome, and that is pain perceived at a location other than the original site. Ooh. And it causes sensations by applying pressure to the trigger points. So say you want to get rid of the trigger point, you press on the trigger point, and the way people know if you have myofascial pain syndrome is if you get referred pain either down your leg, down your arm, and then they know what they're working with. But it is actually really hard to diagnose. You can treat it many different options: heat, wet and dry needling, acupuncture, TENS units, which is electrotherapy, ultrasound, stretching, physical therapy, and then you have your prescription pain relievers and muscle relaxants. And massage is actually a great way to get rid of trigger points. Massage works to release a trigger point by pushing fresh blood in and flushing all the waste material out. This can lead to fibromyalgia, which is a similar condition, but it is all over pain instead of just around where your trigger points are. And 30 to 85% of people will experience myofascial pain at some time in their life. And I chose this because I have experienced myofascial pain in my lifetime, and massage has really helped with it. The definition of myofascial pain: myo means muscle, fascia is the connective tissue. It's kind of fluid-like, and it holds everything together, and that contains nerve endings, so that's where the pain part comes in. And a syndrome is just a collection of signs and symptoms, and they are localized muscle pain in the trigger points, muscle stiffness, fatigue, poor sleep, headaches, and poor posture.